The Argos hemodynamic monitor allows you to measure flow in addition to beat-to-beat blood pressure, which is commonly monitored on patients who are at risk for circulatory shock. As you know, circulatory shock, which frequently presents as hypotension, is an emergency that can lead to damage to vital organs within 1 to 2 minutes. This condition can often lead to acute kidney injuries, myocardial injuries, or other complications. The Argos hemodynamic monitor helps you diagnose the cause of the shock and titrate your therapy to resuscitate the patients as quickly and optimally as possible. Two of the most important requirements for a hemodynamic monitor are accuracy in tracking changes in cardiac output and accuracy in detecting low cardiac output states. Clearly, when cardiac output is low, there is a risk that there is insufficient blood flow or oxygen delivery to your patient's vital organs. Therefore, it is important to detect these situations quickly and accurately. In addition, when you intervene, whether by giving a fluid or a vasoactive medication to your patient, it is important to know how that intervention affected your patient's hemodynamics. It is very well known from the clinical literature that other hemodynamic monitors are quite inaccurate during changes in systemic vascular resistance. The algorithms in these monitors assume that cardiac output is proportional to pulse pressure times heart rate. However, pulse pressure can increase due to an increase in stroke volume, that is from a fluid bolus, or from increases in the systemic vascular resistance that could result from vasopressor administration, for example. These algorithms will report an increase in cardiac output in both of these situations. The consequence is you may think the patient is stable when he or she actually requires an intervention. Alternatively, you may perform an unnecessary intervention. Retia's MBA algorithm, or multi-beat analysis, uses multiple heartbeats to create a more accurate model of the circulation. Developed by an MIT PhD and validated in over 700 patients, this approach defines a model of the circulation, in particular the systemic vascular resistance, and solves for the most accurate model parameters that produce the observed blood pressure waveform. As a result, having a more accurate model of the circulation enables you to monitor changes in the patient's hemodynamics as well as detect low cardiac output states more accurately. Using the Argos hemodynamic monitor, you can make confident, data-driven decisions as you care for your patients with the goal of minimizing or eliminating the time they spent in circulatory shock. By minimizing the time spent in shock, you can reduce the incidence of acute kidney injuries, myocardial injuries, or other complications that often result in increases in hospital stays and significantly greater healthcare costs.